Technology for digital health. Welcome back to Techstination. I'm Fred Fishkin. Joining us from a company called Mytonomy is CEO and co-founder Anjali Kataria. Thank you for joining us, Anjali.
Hi, Fred. Thanks for having me.
Well, give us an idea what Mytonomy is all about. You're not exactly a brand new company. You've been around for a bit, right?
We entered healthcare 5 years ago, and we've built a new platform for patient engagement that uses the power of consumer streaming. It's a video-based engagement platform across 100 plus condition areas and procedures. We've teamed up with 185 doctors and nurses. Over 5,000 years of clinical experience has fused with Silicon Valley, with tech, with the modern platform that we've built to drive a new kind of patient engagement.
And now you're announcing something new with Roku.
So it's our first ever TV app, and it's built on Roku. Let me take a step back. So Mytonomy over the last several years has become an award-winning film studio. We've created high quality content, broadcast quality clinical content for doctors and nurses to deliver to their patients that they can trust. We're becoming the gold standard in patient engagement, patient education, and patient experience. We couple that and deliver that content through a modern platform that's scalable across every condition and procedure area. So we have today over 100 different TV shows that are broadcast quality, can be viewed in the palm of your hand on your mobile phone, on your laptop, on your computer, in the waiting room, in the inpatient unit, in the outpatient unit. And as healthcare is shifting out of the hospital and from the exam room into the living room, Mytonomy today is announcing our first ever TV app, extending our platform to the big screen. So you could be in the comfort of your home, recently discharged, and watching your favorite post-surgery exercises for knee replacement. And your caregiver, your spouse, your partner could be sitting on the sofa with you, learning how to care for you, and for you to learn how to care for yourself. You could be a patient living with diabetes who's newly diagnosed and has to learn how to use insulin. And when the doctor and nurse tell you in the hospital that you have this condition or you've just had a procedure, they're handing you all kinds of paper, and you're going home and you're trying to figure it out. And so we want to make that really easy for all people, all ages, all backgrounds, all ethnicities, all cultures, to be able to absorb that critical information your doctors and nurses are giving you so you can implement it in your living room. And
really,
that's where the TV
really
app
interesting,
comes in.
and it can be interactive as well, I understand.
Very interactive. The platform, the engagement platform, nudges you along. You could have your phone in your hand and you're taking surveys about what you're watching. You're engaging with your clinical team remotely. You're seeing your clinical team. This is a white labeled platform that is cloud-based. It's an enterprise solution across every major condition area and procedure. So the hospital and the nurse and the doctors, the team, they're saving a tremendous amount of time. This is much more efficient in how they deliver care instructions and extend their care to you as a patient into your living room.
How widely used is the platform today?
So we have over 55 hospitals, over 200 clinics that are using Mytonomy, that are under contract to use Mytonomy today. We have academic medical centers like the University of California, Rush University. We have Duke using us on the research side. So this is a solution that's used in big healthcare systems like St. Luke's in Kansas City and regional medical centers like Carilion Clinic. We are used across major institutions to deliver care across almost every condition or procedure and to help hospitals transform digitally, to create that digital transformation from hospital to home.
And describe for us how this came about. What's the story behind the company?
Yeah, so Mytonomy existed before I joined. It was in the ed tech space. It was an education company. with an online video learning platform. And when I joined, I was very compelled by the solution. I had had my own healthcare experiences. My mother became ill and I became a caregiver almost overnight while I had two small children and while I was working in a new job in the Obama administration over at the FDA. And it was a lot to take on the care of an elderly person, your mother, someone you love. And, it's a very emotional experience and it's a lot of work to care for someone properly. And I just thought there has to be a better way to do this. So I never forgot that experience. And then when I left the administration, Mytonomy was just such a gem. I thought this is a solution that could be so successful in healthcare if we could just bring the power of consumer streaming into the living room to help patients and their families really absorb and understand and learn and train themselves on what to do to care for themselves. Because right now people go online, everybody goes online. There's a ton of misinformation. It's really hard to learn and train on your health condition, which is what's needed. And so that's kind of the story behind my joining Mytonomy. I was responsible for bringing us into healthcare, and that was my task and mission. And now the company is 100% healthcare focused. So,
and today, during the pandemic, tell us what your platform has experienced and what it has meant.
Yeah, so my co-founder, Vinay Bhargava, is ex-Google, and I'm coming from Oracle. So we built a solution that was industry-grade enterprise with a combination of a consumer streaming platform combined with an engagement platform. And what we found in the pandemic was an acceleration that all doctors and nurses were moving to a virtual environment very quickly. But the hybrid model that Mytonomy offers, where there's a connection for that patient with their own care team, because they're seeing their care team in videos, they're on the big screen, they're able to watch COVID education, staying safe from people they trust, that we've actually played a role in reducing the misinformation. We've had millions and millions of viewers online. We released the COVID content and made it public, freely available. And almost all of our healthcare system partners used our broadcast platform on their website to deliver important updates. As a studio, we also are a film studio in addition to a software company. We have a dedicated film studio team that works on COVID and keeps the content updated. And we do that for every content area. COVID was just an example of how we modify the content rapidly and keep it updated. But the real story in COVID for us was seeing diverse patients. We had over 750,000 viewers that were watching the Spanish versions of our COVID content and COVID safety and COVID, what to do if you test positive and how to quarantine. Those several video series, those TV episodes were watched very frequently, and they were watched broadly in Spanish when we released them publicly. The data was really compelling that all patients really want to learn how to care for themselves, but we have to be able to reach patients where they are with content that reflects them and also is engaging to diverse patients.
How many languages do you have content in?
We can produce in any major language. We have an entire collection in English and in Spanish, so 2,000 episodes in English, and we're well on our way to transcreating that content in Spanish. I think more than half of that content is already in Spanish across cardiovascular, cardiometabolic, diabetes, hypertension, chronic condition management, common conditions, all the surgeries, et cetera. And we're committed to creating 100% of our content in English and Spanish. And we also produce in other languages, whatever a hospital needs. Whatever different locations have different needs. So sometimes it's French, sometimes it's Tagalog, sometimes it's Hindi or Punjabi. It just depends where you are in the country or the world.
So, for instance, if I'm a cardiologist and I want to produce something to give to my patients. I don't have to do the whole thing, do I? I can
That's
just
right.
do an introduction and say, I would like you to see this video, something you've already produced that goes along with what I would want to tell my patients. Right?
Yeah, that's a very popular model. We do an intro and an outro with the doctor, but an even more popular model is actually refilming some of the doctors and nurses using our existing scripts and making some modifications that to the language, that using words they would use with their patients and really creating a more tailored experience. And we can do that remotely. We're patent pending in a new approach to creating content rapidly at scale that's very high quality, broadcast quality that looks fantastic for, we're filming in 6K and 4K and high definition so that it's engaging to watch by the patient, that features their doctor or their nurse.
Where do you see this going?
Yeah, sure, Fred. What's next for the company in terms of TV apps is building more TV apps for LG, Sharp, Samsung, and Apple TV Plus. That's directly on our roadmap because we want to help hospitals deliver this important information in a more efficient way in their waiting room, in their inpatient unit. And many of the hospitals use these TVs. And so if we can provide them with a TV app, it's a whole new game in terms of being able to deliver a seamless, continuous experience to their patients while they're in the hospital and then also when they go home. I do see the power of industry cloud becoming something very ubiquitous across many hospitals, many conditions. Millions of patients will benefit from Mytonomy. And I think patients will transform their health. I think where we're going is helping patients in every walk of life, every socioeconomic background and condition, be able to access trusted healthcare instruction remotely and on their own schedule. Our data shows, for example, our African-American male patients, 50% of them are watching cardiac content between 11 and 12 at night. So that's a great time to reach them. So I think we're also going to take the insights that come from the viewership of our content in your living room. We're going to take those insights and we're going to apply them back. And we're going to change how healthcare is delivered. Look, this happened in the information services sector. It happened in the financial services sector. We used to go to a bank to deposit our paycheck and stand in line, 30 years ago. Now we do everything remotely on our phone. And I think the same thing is going to happen in healthcare, but there's going to remain a connection between a patient and their care team. And that's where the power of video and streaming comes in. And that's where Mytonomy is perfectly situated.
So for more information, where can people go?
Well, we'd love for you to go to Mytonomy's website. We have a lot of information, www.mytonomy.com. We have a lot of information about all the different conditions and procedures that we cover and what the TV app looks like on Roku. We have a little video that you can watch to see what that would look like in your living room. And you can see some of the engagement capabilities of using Mytonomy to nudge your patients along and remind them of certain things. And we work in tandem with existing CRM solutions like Salesforce and Healthgrades and Microsoft Dynamics, along with the existing EMRs, Epic and Cerner. So you'll be able to see what some of those interfaces look like if your hospital or your provider team uses some of those enterprise solutions.
And it's spelled Mytonomy.
That's right. Yeah. Mytonomy, because we want to set doctors, nurses, and patients free and be able to access important instruction in a more efficient and a higher quality way.
Terrific. Anjali Kataria, thank you so much for taking the time with us.
Thank you, Fred, for having me, and Happy New Year.